A national tragedy, thousands infected, thousands dead. The UK faces a public health catastrophe. Tens of thousands of people, many needing regular blood transfusions, were infected with deadly viruses. This happened over decades, starting in the 1970s. The viruses, HIV and Hepatitis C, spread through contaminated blood products. These products, like Factor VIII, were meant to help patients. Instead, they delivered a death sentence. The scandal, a tragic mix of negligence and poor judgment, has left an indelible mark on the UK. Around 30,000 people were infected. Estimates suggest over 3,000 deaths are directly attributable to the contaminated blood. This tragedy is a stark reminder of the importance of public health systems. It highlights the devastating consequences when those systems fail. The scandal has eroded public trust in healthcare. It has also fueled anger and calls for accountability. The infected blood scandal, a dark chapter in British history, continues to cast a long shadow. The fight for justice continues. The scandal's impact goes beyond the staggering numbers. It's about individual lives shattered, families torn apart, and a nation grappling with a preventable tragedy. This is the story of the UK's contaminated blood scandal, a story of human suffering, institutional failure, and the long fight for justice. The how and the why, a series of missteps. The scandal unfolded due to a confluence of factors. One key element was the UK's reliance on imported blood products. During the 1970s, the demand for these products outstripped domestic supply. This led the UK to source Factor VIII from higher-risk donors in the United States. These donors, often paid for their blood, were more likely to carry infections. Another critical factor was the lack of robust screening procedures. Early tests for blood-borne viruses were unreliable. However, even as testing improved, implementation remained patchy. This allowed contaminated blood to slip through the cracks. Compounding the problem was a culture of secrecy and a reluctance to acknowledge the issue. Early warnings from within the medical community were ignored. Concerns about the safety of imported blood were dismissed. This delayed crucial action and allowed the crisis to escalate. The government's response was slow and inadequate. Victims were often left in the dark about the source of their infections. They faced stigma and discrimination. Many were denied proper treatment and support. The scandal's roots lie in a perfect storm of policy failures. A lack of oversight, coupled with a disregard for patient safety, created the conditions for tragedy. The result was a public health disaster of unprecedented proportions. The human cost lives forever changed. John, a young haemophiliac, was excited to receive regular Factor VIII treatments. He believed they held the promise of a normal life. Instead, they delivered a devastating diagnosis. Hepatitis C. John's story is just one of thousands. Each person infected represents a life irrevocably altered. Many victims, like John, were children when they received contaminated blood. They grew up with the shadow of their diagnosis hanging over them. They faced prejudice, isolation, and the constant fear of their condition worsening. The emotional toll on victims and their families is immeasurable. Many describe feelings of betrayal, anger, and profound sadness. They grapple with the knowledge that their suffering could have been avoided. The scandal's impact extends beyond physical health. Victims talk about the loss of trust, the shattered dreams, and the constant struggle to cope. The contaminated blood scandal is a stark reminder of the human cost of institutional failure. It highlights the devastating impact of policy decisions on individual lives. The stories of victims like John serve as a powerful call for justice. They demand recognition, accountability, and a commitment to prevent such tragedies in the future. Section 4. Accountability and justice. A long road ahead. The fight for justice has been long and arduous. Victims and their families have campaigned tirelessly for recognition and compensation. They demand accountability from those responsible. The government, after years of denial and delay, finally launched a public inquiry in 2018. The Infected Blood Inquiry, one of the largest statutory inquiries in British history, aims to uncover the truth. It seeks to understand how the scandal happened and who was responsible. The inquiry has heard harrowing testimony from victims and their families. It has exposed systemic failures, negligence, and a culture of secrecy. The inquiry is ongoing, but it has already shed light on the scale of the scandal. It has also brought renewed hope for justice. However, true justice remains elusive. Many victims feel let down by the government's response. Compensation schemes have been criticized as inadequate and bureaucratic. The fight for accountability continues. Victims and their families are determined to ensure that those responsible are held to account. They seek not only financial redress, but also a genuine acknowledgement of the harm inflicted. The pursuit of justice is a testament to their resilience. It is a fight for recognition, dignity, and a promise that such a tragedy will never happen again. Section 5. Preventing future tragedies, lessons learned. The contaminated blood scandal holds crucial lessons for the UK. It underscores the importance of robust public health systems that prioritise patient safety above all else. It highlights the need for transparency and accountability in healthcare, and it emphasises the importance of listening to and acting on early warnings. The scandal has led to significant changes in blood safety protocols. The UK now has some of the most stringent screening procedures in the world. These measures have drastically reduced the risk of similar tragedies occurring. However, the legacy of the scandal persists. It serves as a stark reminder of the importance of vigilance and the need for continuous improvement in healthcare systems. The fight to prevent future tragedies goes beyond strengthening regulations. It requires a cultural shift, a culture that values patient safety, encourages open communication and learns from past mistakes. The UK must ensure that the voices of victims are heard. Their experiences must shape future healthcare policy. Only then can the sacrifices of so many be honoured. The UK's contaminated blood scandal is a stark reminder of the human cost of complacency. It is a call to action for governments, healthcare providers, and society as a whole. A call to prioritise patient safety, demand accountability, and strive for a future free from such preventable tragedies.